You're watching ABC 36 on your side. Good Day Kentucky.
Hey friends, welcome back into Good Day Kentucky. Our next guest not only here to bring awareness for National Thyroid Awareness Month, also here to preview a brand new segment coming to Good Morning Kentucky later this month, and it's called Prescription Health.
And it's a new weekly segment where a rotating panelist stops by prescribing you the latest medical headlines as you head out the door. And we're happy to be joined by one of our contributors, Dr. William Inabnet. Thank you so much for being here today, first of all, Doctor.
Good morning. Thank you so much.
So let's get right to it. And let's kind of back things up a little bit, too. What exactly is the thyroid, and why is this an important area of our body?
Well, first, this is Thyroid Awareness Month, the month of January. The thyroid gland is an endocrine organ that sits in the neck, and it controls the body's metabolism or metabolic rate, which is the process of how the body processes the food you consume into energy, and every cell in the body needs energy.
Yeah, exactly.
So how would you know if your thyroid wasn't working the way it should?
Well, there's two broad conditions. The thyroid gland can be overactive or underactive.
Okay.
If it's overactive, it's making too much thyroid hormone, and that could lead to symptoms such as panic attacks, anxiety, heat intolerance, hair loss, palpitations of the heart, things where your metabolic rate is higher. With an underactive thyroid gland, your metabolic rate is lower, and that can cause things such as depression, weight gain, thinning of the hair, and so forth.
I bet education plays a big role here too, because some of those symptoms people may just say, I'm living with this. This is something that I shouldn't be worrying my doctor about.
That's correct, but about 20 million people in the United States do suffer from thyroid disease.
Yeah.
Wow.
So it's fairly common.
And then also, you know, there's thyroid disease, but there's also thyroid cancer too. And how pertinent is that in our society right now?
Well, about 50% of the population does harbor thyroid nodules, but only 5% of thyroid nodules are in fact malignant. Thyroid cancer is one of the, I guess, best type of cancers to have. There's no good type of cancer, but the prognosis is generally very favorable, and there's a combination of surgical therapy and other therapies that are indicated for thyroid cancer.
My goodness. Okay, so as Surgeon-in-Chief at UK, can you give us walk us through for folks that one of those symptoms you mentioned may have got them thinking, how do they start this process?
Well, there's a self-examination process called Check the Neck. And basically you can palpate your neck where your thyroid gland sits over your airway. And if you feel a lump or a nodule, then that may warrant an investigation. And typically an ultrasound examination of the neck is the best way to diagnose a thyroid nodule. If a thyroid nodule is diagnosed, then in many cases a thyroid biopsy is indicated, and that information is helped to determine what the next steps are, either observation or surveillance, or an operation to remove a portion or all of the thyroid gland.
Wow.
So when they feel that, how nervous should they be at that moment if they do feel something is not quite right?
That's a great question. You definitely should not panic. If you feel something in your neck, you feel a thyroid nodule, know they are very common, and most of them are benign.
All right, good.
Gotcha. Okay. What is your best advice for people that are doing that self-exam and may think that they need to take this to the next step?
Well, I think if you feel a lump or a mass in your neck, particularly over the thyroid gland, then you should probably seek out your primary care physician for further guidance.
Okay,
Gotcha.
all right, wonderful.
Well, we know how busy you are at UK, so we're very excited that you're going to be part of our team and helping us with this new series that we're launching.
Thank you so much. We have a very large department of surgery with many specialties represented, and it's a great honor to be here this morning. Thank you so much.
Yeah, we're glad to have you. And for folks that are watching right now, what would you hope that they're taking away from this segment right now, us talking about the thyroid? What are your hopes?
They can remember one thing.
Yeah.
Well, I think having patient-centered care is of utmost importance, and so that patients should really advocate for themselves.
Right. Yes.
And that's a very important part of healthcare in general.
Yeah.
Excellent.
Well, thank you so much for being here with us today. We really do appreciate it.
Honor. Thank you so
much. Looking forward
much.
to working with you.
Have a wonderful day. Thank you.
You too.